Hey everyone, I'm waiting for this. It just seems to take a minute to catch up with the Zoom. So just bear with me for just a second while we let this catch up and go live. And as soon as it does, then we'll go ahead and get started. So welcome to night 3 of our 4-night series when it comes to how to lose weight, some of the different things that you can do to improve your outcomes, why you gain weight in the first place, and therefore understanding how it is that you get it to come off. So let me grab my phone and see if we're on here or not. So it looks like it's still connecting. So just a minute. There we go. So it looks like I'm on. So good. So we'll go ahead and get started. So again, welcome everyone to night number 3 out of a 4-night series when it comes to how to reverse insulin resistance. I am going to turn on my chat real quick just so I can see questions as they come in. So please feel free to put questions in the chat. I'm happy to answer them as best as I can. If I miss a question, make sure to post it again because they're hard to go scroll through the entire way. So for those of you who don't know me, my name is Lindsay Venn. I am a physician assistant, a registered dietitian, and a metabolic health practitioner who specializes primarily in metabolic health and hormones. And so this is a topic that is near and dear to my heart because most of my patients come to me, at least in part, with an effort to lose weight and struggles that they've encountered on that journey. So let me grab my iPad and we'll get going with the presentation I have prepared. Tonight's topic is all about tools and supplements and different things. It's above and beyond just supplements that are available in order to help, especially for those who feel like they might be doing everything right when it comes to the stuff we've discussed the past 2 nights. So things like diet and fasting, um, stress management, sleep, etc. So these are just some additional tools. Not one size fits all in anything medicine. And so I'm sure you all know that. And so if you've tried everything I've suggested and really still struggled some more, some of these tips tonight are going to be very helpful just to make sure you're doing everything else that you can do to optimize the situation. And then tomorrow night, we'll actually really deep dive into what else might it be? Might it be your hormones? Might it be your thyroid? Other things like that. So here we go. So first of all, again, this is my little disclaimer. This is not personalized medical advice. I am not your doctor. So please do not take this like I am your doctor. Make sure to speak with your doctor if you have any concerns. So a brief recap of what we've talked about so far. Why people are struggling with their weight over the last 50 years. We now know that, and it's because of the food guidelines. It's because what doctors and PAs and dietitians and personal trainers, you name it, what they've all been taught to teach you was all wrong, and then what the FDA has enforced over those past 50 years. So, and then why you shouldn't believe it. You know, we've proven, and I proved in that first night. And if you didn't catch the first night, please go to YouTube at Venn Integrative Medicine. You'll find it there, or you can DM me and I can send you a link. But lots and lots of data out there that shows that all of the information that we've been given was inaccurate, and the results that followed, the increased prevalence of diabetes, insulin resistance, obesity, etc. So we taught you about the real science about weight gain and how to lose it and keep it off, different application principles to help you start with your weight loss journey, and then benefits to your health from trying to live this way. So, but is there more to it? Of course there is. So tonight we're going to dive into medications, prescription medications. We're going to dive into supplements, food addiction. Food addiction is a real thing and a significant problem when trying to make lifestyle change. Things that you can do to track your progress that can be very helpful, and then again, some extra help. So first of all, let's talk about medications. There's a lot of different medications out there that are what we call obesogenic, meaning they will lead to an increase in your weight or an increase in obesity. And there's a lot of varieties to this. And like I say, kind of up here at the top, there's a lot of nuance to it as well. So the hard part, especially with the first list of medications here, the antidepressants and antipsychotics, these are really difficult for people to try to come off of. But if they're struggling so significantly with their weight that these medications are actually more harmful than helpful in certain situations, then it is something you need to work with a well-versed provider on. One of the best books out there, if you want to check it out, is called Brain Energy by Chris Palmer. And he's a psychiatrist who was treating schizophrenics and severe bipolar disorder and things like that, and watching his patients become super obese because of these medications. And he started treating them with, they started treating the weight loss, not the mental condition, but treating the weight loss with a ketogenic diet. And he noticed that not only were these patients losing weight, but they were able to start reducing the dosage or the number of medications that they were on. So we do know that they kind of play a role. These meds will increase insulin. So if we can keep insulin down with diet, it can be helpful. Insulin stimulating medications, these are also another problem. A lot of our very first line diabetic medications, things like their sulfonylureas are the names of them. So glypiride, glimepiride, glyburide, medications like that. Actually, their job is to make you make more insulin in an effort to lower your blood sugar. And as we discussed earlier in the previous two meetings, if we're making more insulin, we just become more resistant to it. And so we're just worsening, again, weight and insulin resistance, and therefore it'll lead to diabetes down the road. Steroids are a real problem. And this is unfortunate for people with autoimmune diseases because sometimes the only relief they get will be from different steroid medications. But it can also even be a problem even in people with things like asthma, people getting chronic pain injections, like joint pain injections that are steroids. Those can be a problem as well. So you want to make sure that you're only taking a steroid if you absolutely need to. Beta blockers, these are primarily used in high blood pressure. And so if you have high blood pressure and you're on a beta blocker, so things like propranolol, atenolol, those are common names of those. These beta blockers can actually also lead to weight gain because of their mechanism of action. So be careful with those. And again, remember, the weight gain is going to worsen insulin resistance. The insulin resistance is going to worsen blood pressure. And so you kind of have this vicious cycle going on when it comes to using beta blockers for hypertension. And then last, gut altering medications. I include these because when you alter your microbiome, you can alter your gut. And that gut problem can lead to leaky gut, which can lead to inflammation, which can lead to insulin resistance, and again, more weight gain. And so this includes things like Prilosec, Zantac, omeprazole, anything along those lines that's altering the gut, whether it be the pH of the gut or the flora of the gut, you want to be careful with when it comes to something that might lead to more weight gain. Supplements. So supplements are an interesting one, and I put in here on purpose or lack thereof because there are some supplements that are necessary. Unfortunately, our food system has been so monocropped that the nutrition in our vegetables, for example, and our fruit even, is less nutritious than it was. And so we need to be able to get these important things from somewhere. The other problem, especially in people who don't live near the equator, is low vitamin D. If your vitamin D is low, even if it's normal, like they say, vitamin D being insufficient will lead to more weight gain and insulin resistance. So D3 is something I recommend everybody, unless you live like me in Belize near the equator, then you need to be on some kind of a vitamin D supplement. And we'll dive into this a little deeper. Vitamin K2, it helps with the absorption of D3. It's also very helpful with people with concerns of coronary artery disease or osteoporosis because it will pull the calcium from the bloodstream and put it into the bones. And if there's less calcium in the bloodstream, there's less chance for calcification in the plaques in the arteries. Next is magnesium. I did put on here, everyone should be on this. I do think this is a definite must-have, especially if you're incorporating insulin smart lifestyles. First of all, our diet doesn't get it for us no matter what you're eating. But second of all, we tend to deplete this when we have low carbohydrate diets with intermittent fasting. Omega-3s is next. I do really recommend that people take an omega-3. It's very anti-inflammatory. And again, one of the main three primary causes of insulin resistance is inflammation. So if we can lower inflammation, that's helpful. But also because we have been inundated with polyunsaturated fats or the seed oils. And so we get a really bad imbalance of omega-3 to omega-6 by eating this way. And even if you're not eating that way anymore, but you have historically, we do store fat and we do store omega-6 and we do store omega-3. And so if you have a history of a lot of seed oils, which most of us do growing up, around my age, then you want to make sure that you're optimizing that omega-3 to offset that previous poor ratio. Methylated Bs are beneficial to most people, and I'm going to talk about that a little bit more. And then iodine can be really helpful for people with any kind of thyroid or glandular disorders. So again, a quick deep dive into this so you have an idea. Vitamin D will improve your insulin resistance. It also is very, very important for immune function. and for improving fatigue. If you suffer from fatigue and you're not on a vitamin D3 supplement, then you want to make sure to try this out because it will help. The reference range on lab that you will see if you get this tested is 32. Some of them are 80, some of them are 100, but 32 around 100 is the reference range. We want this to be optimized. So much higher in the 80 to 100 range is where you want your blood panel to come back at. Most people need about 5,000 IUs daily. Again, if you're out in the sun a whole bunch, maybe that's not quite, you don't need quite so much. But most of us, when we're outside, we're not in our bathing suits, we're in clothes. And so the amount of exposure we're actually getting to the sun isn't what we think it is, even if we're outdoors a lot. So 5,000 is a pretty safe dose. If you check your vitamin D levels and they're low, I do recommend to go even higher. So just to boost the benefits that you get from it. It does come in a combo supplement, which is what I really like. The problem with the combo supplement is that most places, the amount of K2 is inadequate. We want you to get around 400 to 600 micrograms of vitamin K2, and most combination products are actually only about 100 micrograms. And so either one, you need to add more K2 on its own, or two, find one that's good. I've listed the two that I like. ADK by Da Vinci has the 5,000 IUs of D3 and 500 micrograms of K2, so I like that one. I will provide you with a Fullscripts link at the end, so if you want to order it from a reputable store, they are finding that all the tampering that's going on in places like Amazon makes you just unsure what you're actually taking. So I do recommend to use a store such as Fullscripts, so you know that it is been taken care of properly, it hasn't been tampered with, etc. And then the other place that I like their ADK, they call it ADK5 because it has the 5,000 IUs, is BioTE. And so I have the link here. For anyone who can't see these or read these or whatever, I will try to put them in the chat at the end. And if you can't find them in the chat, just DM me and I'm more than happy to message you back and get you the links to these. I am going to provide you a lot of links tonight, so be ready. For the magnesium, so there's lots and lots of different kinds of magnesium out there, and there are specific kinds that we want you to get depending on what you're concerned about. And so magnesium glycinate is my go-to for most patients. The reason being is it's gentle on the bowels. Some other ones are harder on the bowels and can lead to soft stools, tarry stools, or diarrhea. So magnesium glycinate is pretty gentle, and then it's also really good for muscle cramps, and so we like it for that reason. Magnesium citrate, on the other hand, if you're struggling with constipation, that's the better route to go. You're going to get more relief of your constipation that way. And then magnesium threonate is really good for the mental stuff. And so whether it be sleep or cognitive issues, the threonate is probably the best. They all are going to help you sleep. And so we do recommend to take them at bedtime so they'll enhance your sleep. And then I recommend to start out at a 400 milligram dose and then titrate according to how your bowels respond. If that dose is too much and you're struggling with some diarrhea, then cut back. If you're struggling with constipation, then you can go up. So just titrate it. You're not going to overdose on this. And then for people who are super sensitive, I have several patients who are very sensitive to oral magnesium. If you can't tolerate it because of your bowels, then I do recommend to get a soak form, and there's lots of different ones out there. Epsom salts is an example that you can get really easily over the counter. We use one called Living Your Best Life with Insulin IQ all the time. They've got a good one too. Omega-3s are next. And so I did put on here, this is very important. The brand does matter when it comes to omega-3s. If you are buying your omega-3s from Costco or some other big box store or wherever, this is actually almost worse than not taking it at all. And so we want to make sure that you're spending the extra money. I know they're more expensive, but we want to make sure you're spending that extra money so you're getting the benefit from them. And so I recommend 2,000 to 4,000 milligrams per day. They usually come in 1,000 milligram capsules, but make sure to read the label. They will give you the amount of EPA and DHA, which are the really important ones, or they'll give you the amount of actual omega-3, and just make sure that the majority, if not 100% of the omega-3 you're taking is omega-3. A lot of the cheaper ones are also omega-6. And again, you're offsetting that goal of getting better balance by doing that. So why do we want to take this? It helps with inflammation, like I mentioned before. It helps with immune function, and it will help improve your insulin resistance when it comes to your fat metabolism. So, and I will, again, the Fullscripts link I will post, and you can see the couple of recommended brands that I suggest. Methylated bees, and the reason I'm using the word methylated here is important. And so let me start over. Most of our bee supplements that we get are not methylated. So cyanocobalamin is the name of the B12 that most supplements or injectables are. If you have something called MTHFR, it's a genetic mutation that they've found that about 45 to 55% of the US population has. And so you can almost assume if you don't have it, your spouse probably does. Um, because this prevalence is so high, I recommend to get the methylated form because with this mutation, you are unable to do exactly that. You can't methylate the cyanocobalamin and therefore you can't use it. And so if you just take a methylated form, you bypass this potential barrier to the benefits of B, and then you don't have to worry about it. And there's so many of these out there now. I primarily recommend the pure encapsulations. It will be in the Fullscripts link as well, but this is a really good one to take. It'll help with things like energy, anything nerve related or brain related. Bees will help with, and again, with weight loss, insulin resistance, that kind of stuff, they're beneficial. And then last is iodine. Iodine used to be a big problem until they started fortifying our foods with it. We used to have lots of goiter, 50 to 100 years ago, and it's starting to come back. It's funny because now that we've incorporated all of these fancy salts, the sea salts and kosher salts and all of that, they're not iodized. And so we're losing iodine from that source. But then we're also, if we're following the diet that I recommend and we're avoiding processed foods, then that fortification with iodine goes away. And so I do recommend iodine supplementation for most people, especially in those with thyroid problems or any kind of glandular function problem. So other glands, things like the prostate, for example. So in the dose I recommend on this is 12.5 milligrams per day. Lots and lots of iodine supplements are way below this. They're at like 50 micrograms. And so you want to make sure you find one that has this higher dose in it. So other helpful supplements I didn't mention at the very beginning that you might want to consider, if you have significant insulin resistance or you think you might have significant insulin resistance, berberine is very helpful. It is nature's metformin, which is the medication that a lot of people are on for their insulin resistance. And so berberine is a good one to use. It is a lot easier on your GI tract than metformin is, and it works very much in the same way. Can also be helpful with things like cholesterol. I've heard some things about liver with this as well. And so 2,000 milligrams per day is what I recommend. And I recommend to divide that dose up with your meals. So if you're doing 2 meals a day, do 1,000 twice a day. If you're doing 3 meals a day, do 1,000 with your bigger meal and 500 with the other 2 meals. Inositol is very similar. It works very much like berberine. The dose is exactly the same. This one is a little bit more specific for people with PCOS. And so if PCOS is a concern, you might choose that one instead. But otherwise it can be helpful. And then last, Akkermansia. This is a bacteria that we make in the gut, that most people make in the gut. And the studies on it are pretty astounding when it comes to blood sugar lowering benefit. And so if you can do a stool test and find out what your Akkermansia levels are, that's great. If you can't, and you want to take a probiotic to help with blood sugar control, Akkermansia is a good one to try, specifically for blood sugars. And this too is in the Fullscripts link that I'll share. So let's move on to other things besides medications and supplements. So food addiction, this is a big, big, big problem. And the biggest problem with it is because it's not like other things that we get addicted to. You can't just stop eating. You have to eat. And so you can't just completely abstain from food. And unlike things like alcohol or cigarettes or drugs or whatever. And so this is something that you have to figure out on your own, and some strategies that we recommend. Number one, you have to do some real self-reflection. And when I say real, I mean, you really have to be honest with yourself on, am I truly addicted to this? Am I craving it when I'm not hungry? Is it controlling my life? Am I making bad choices even though I know they're bad choices? That's one of the biggest signs of addiction, is that you continue to make the choice even though you know it's harmful to your health. And so if that's the case, food addiction might be part of the problem. Really looking at yourself as, can you be, when it comes to the specific foods you're addicted to, if it's sugar or if it's bread or if it's salty foods like pretzels and tortilla chips, some people can moderate. They can have a couple of bites or eat it once and then walk away and be done with it. Those people can be what we call moderators. people who can't, and there's lots of them out there who, if they even look at a donut, they're going to go eat the entire box. Those people are much better off if they just completely abstain, just like you would from something like alcohol. You're not going to suggest to an alcoholic who's now recovered, oh, hey, you can just have one beer. It's not that big of a deal, because you know the addiction will come back in. And in a lot of situations, it's the same with food, especially if you can figure out which specific food is the main trigger. Lowering your insulin will help with this. You know, insulin is again driving those hunger cues, particularly for carbohydrate high foods. And so if you can get insulin down, this will help. And so the strategies that we talked about last night can be very helpful. Make sure you have a support system in place. You know, you don't want anybody sabotaging your efforts and bringing over foods that they know you struggle with. And so making sure you have the right support system, and then making sure you're planning ahead. A lot of times when we step off track or fall off the wagon, whatever you want to call it, it's because we weren't prepared. And so if you can be prepared, if you know that these foods that you're addicted to are going to be present, go with a plan. You know, have an alternative in place that you can take with you. Oftentimes, like with ordering at restaurants, I just tell people, you know, look at the menu in advance. And that way you can make the decision at home before you have all of those triggers in front of you while you're there. So these are some simple strategies. It is a deep problem and could definitely use a lot more discussion on. And this is where we'll talk about a little bit more of that when it comes to support groups and stuff. So what about special events and holidays? And this ties in, and I put this here on purpose, this does tie into food addiction. Plan ahead, it's huge. Make sure that you are planning ahead. So some strategies I have is, you know, for Thanksgiving that we just had, or for Christmas dinner, or whatever it might be, maybe offer to host. It's a lot of work, I know, and it's a lot of money to be able to do that, but then you're in control of the menu. You don't have to worry about what you're going to have to choose from if you're hosting the event. When you're going out to eat, make sure to look at those menus again prior to, and that way you can choose before you go, and then just be steadfast when you get there. The thing I always say is you only have to be strong in the moment. You know, if you're driving through a fast food restaurant, if you're ordering at a restaurant, at a sit down restaurant, you only have to be bold and strong for that, you know, 30 seconds that you're placing the order. So be strong for that very brief snippet of time and then move on. We do like to talk about at Insulin IQ, we do like to talk about the 3-bite rule. You know, they do say that after the first 3 bites, your pleasure centers and all of those warm fuzzies that you get from that food really are diminished quite a bit after the first 3 bites. And so if you can moderate, allow yourself the 3 bites. That's just fine. Enjoy the 3 bites, push the plate away and be done. This is a good option for a lot of people, especially again during the holidays and whatnot. I encourage people to flex their fasting muscle. This is what we do here a lot. If we know that we're going to be going out and we're probably going to deviate from the diet, I'll fast all day. So instead of, you know, having lunch and dinner that day, maybe I won't have either, or I won't have breakfast or lunch, and then I'll just have dinner. And it gives me a little bit more flexibility with what I choose. So flex that fasting muscle to help when you have a special event or holiday. And then the biggest tip is when you slip, because everybody does, when you slip, get right back on track. I can't tell you enough. I do it myself sometimes, where we set this arbitrary date of, oh, I'll get back on track on Monday, or I'll get back on track on the first of the month, or I'll, you know, whatever. Don't get right back on track right now. There's no reason you can't just step away from what it is you're doing, say, oops, I screwed up, and now I'm going to move on and get back on track right now. We had a coach named Emily who used to say, you know, it's a flat tire. You know, you don't delay until Monday to fix your flat tire. You go and you fix it right now. So consider you're falling off the wagon like having a flat tire, and go get it taken care of so you can get on down the road. So some other tools that you can use to help. So accountability tools that are there. The first one that I really like and do recommend for a lot of people is a continuous glucose monitor. I'm going to go into more detail on that. Ketone monitoring is a really good option when it comes to really measuring your insulin status. Different labs that you can monitor very easily and inexpensively. Support groups, Insulin IQ is an excellent source for this, and same with the one-on-one coaching. Insulin IQ has a great team that is good for that if you don't have it at home. So for the CGMs, or the continuous glucose monitors, these allow you to learn what specific foods do to you. Can't tell you how many times that I'll have somebody say, hey, watermelon doesn't do anything to my blood sugar. Well, good, you're lucky, because for a lot of people, it really spikes their blood sugar. But how do you know? You don't know until you've tested it out on yourself. This is so much easier than trying to prick your finger, before your meal, after your meal, 30 minutes after your meal, 60 minutes after your meal. And so the CGM is really great. And that way you can figure out how your body responds to things. The things that we look for when it comes to these CGMs and insulin resistance and weight, the biggest one is if your blood sugar goes up and it stays elevated for greater than 2 hours, then we know you have some insulin resistance going on. The other piece that I have people watch for as well is if you establish a baseline, say your baseline is between 90 and 100, you eat something and it spikes up to say 130, which is a perfectly acceptable number to spike to, but then it crashes below that baseline of 90 to 100, that's another indicator that you're excreting too much insulin in response to that food, and that food should probably be avoided, reduced, or change the timing of your meal. The CGMs don't have to be long-term. Most people I recommend to wear them for a month or two. We tend to repeat what we eat, and so that makes it really easy. You'll have a really good idea what something's going to do to you. If you've tried it before, it's likely to do it the same way again. And they are a lot easier to get now. This has been really great. They are over the counter. And so the two that we have available in the US, the Stelo is a Dexcom sensor. And the Dexcoms do seem to be more accurate when it comes to their actual readings. They are a 10-day sensor. And so you would get 3 of those that would cost you this $89 to $99 a month. The nice thing about those two is you can calibrate them. If you have a way to stick your finger and compare it to your Dexcom, then you can turn around and calibrate it and make sure your numbers are always accurate. The other one that we have is from Hello Lingo. This is an Abbott product called Freestyle Libre. This is also a great one. These are 14-day sensors. They're not quite as accurate, but they're super easy to use. I really like them because I can actually connect with patients with the Freestyle Libres, so I can actually see their numbers. And the price range on this, depending on where you get it, can be anywhere from $75 to $100 per month. And then the last option is if your doctor will prescribe it, your insurance might cover it, especially if you have diabetes. If not, Abbott, I know, offers a really good coupon for the Freestyle Libre that I can connect someone with if they're interested in. So the next thing to monitor and track that can be very helpful is ketones. And so like we talked about yesterday, when you burn fat for fuel, you turn some of that into ketones. And so ketones are just the byproduct of fat burning. We're not trying to, the ultimate goal isn't, oh, I got to have ketones, I got to have ketones. The ultimate goal is to burn fat, and the byproduct of that is going to be having ketones present. They are inversely related to insulin, and this is why it's helpful. There's no way to measure your insulin at home, so you can't keep track of that. But if you can measure your ketones, the higher the ketones, the lower the insulin, and vice versa. The lower the ketones, the higher the insulin. There is no real benefit to being really high. It actually can be dangerous depending on any medications that you're on. So really typically our goal for people is to be between 0.5 and 3.0 on a blood monitor. That's great nutritional ketosis. It means you're burning fat. It means your insulin levels are low. So we like those numbers on the blood ketones. I recommend doing the blood testing because I like them to be accurate. If I'm going to have data, I want to know that it's right. Breath testing is really nice though, because it's a one-time expense and you don't have to prick your finger. You have to prick your finger in order to do the blood testing, obviously. But the breath testing, you want to get a good one. The cheap ones do not work very well. The good ones cost like $250 to $300, but it's the one-time purchase. And so you're done, you buy it, you can do it as often as you want. You can share it with your family members. It's a good investment when it comes to those pieces. The blood testing, where it becomes a little more expensive, is you have to continue to purchase strips over time, which does add up, depending on how often you're checking. I don't recommend to check all the time. I recommend to check maybe once or twice a week, or if you're trying to test something out, that's when we would want you to check the blood ones. So the one I recommend is Keto Mojo. They're a great company. I have a bit of a partnership with them. I just wrote a blog for them that published yesterday or today, maybe. So anyway, so they're a great one. Again, I can get this link to anybody who's interested. I believe there's a 10% or 15% coupon associated with it. So, and then for the breath tests, the ones that we recommend, the Ace Track or the Keto Scan Mini are the two most recommended. I know Ace Track was on back order not too long ago. I'm not certain of the status now. So lab monitoring, and when I say lab monitoring, I'm talking about going to a local lab and getting your blood drawn. Some things that you would want to check, of course, a fasting insulin is really important. The goal there I have again listed is less than 6. You can use this if you have a glucose, whether it be a glucose from your CGM or a glucose from a finger stick or a glucose from the lab, to calculate something called a HOMA-IR score. This HOMA-IR stands for the homeostatic model of assessment of insulin resistance, and it'll give you a severity score. And so that's really important if you want to know how bad is my insulin resistance. This will give you a good indicator, and then also gives guidance when it comes to how strict you need to be with the diet and fasting. Using a lipid panel can be extremely helpful. I use this a lot for people who can't get an insulin or don't have one when they meet with me. And so if you take a triglyceride to HDL ratio, meaning divide your triglycerides by your HDL. And I'll just do a little example here. So like a normal triglyceride level, not good, but a normal triglyceride level would be 150. You divide that by a normal HDL level, which is like 50, and your triglyceride to HDL ratio would then be 3.0. As you can see, we want it to be a lot lower than that. You know, the goal is less than 1.5. If you want to be a rock star, we want to get you to 1.0 or less. C-peptide's an interesting one. This one is primarily recommended for those on exogenous insulin. If you measure an insulin level, it will measure both the insulin you're making in your pancreas plus the insulin that you're injecting. And so if you're on exogenous insulin, you want to make sure to get a C-peptide to make sure if you're making insulin or not. Insurance, unfortunately, doesn't like to cover these more often than every 3 months, but they typically will cover it every 3 months. So you can certainly use your insurance if you have a provider that'll order it for you. Or like I say here, there's some really great cash pay options. I offer 2 different ones, and you can get all of these labs, the insulin, the glucose, the lipid panel, and the C-peptide for about $30. And so very, very inexpensive, and these are very accurate. So that's a really good, reasonable thing to consider for tracking. So when it comes to other forms of tracking, we're talking about food and activity here. You know, things like MyFitnessPal, for example. I love them and I hate them. You know, the problem is for a lot of people, honesty can be a big barrier. They're like, oh, I'm just not eating as much. You know, I only eat twice a day. And they don't realize that every time they walk by the snack jar or by the refrigerator that they're grabbing something, it's almost this mindless eating. And so tracking oftentimes will help us do a better job of understanding what's going on. It helps us better determine our portions. A lot of times, you know, we'll just say, oh, I had a chicken breast and a salad. Well, was it a 3-ounce chicken breast? Was it a 10-ounce? You know, how big was it? How much salad dressing did you actually put on? Those kinds of things tracking can help with. They'll help you identify recurrent problems. It'll help you determine your calorie intake. Again, calories are not the number one thing that we're worried about. We're worried about insulin. But if your calories ramp way up, even though you're following an insulin smart diet, you can have struggles with weight loss. And so we want to make sure we're at least checking in on where our calories are on a regular basis. The thing that I don't like about them is OCD people like myself, these things can sometimes backfire. You know, if you're thinking about tracking all of the time, then you're thinking about eating all of the time. Does this stimulate some extra eating? In some people, myself included, it can. And so if you're that kind of person, maybe figuring out a different way to track things is better. And then this one, support groups and coaching. Again, Insulin IQ, those of you who don't know, I do work at Insulin IQ as well. We do have a community membership available that's fairly inexpensive. It's great because we meet almost every day. You can meet other people in your same situation and talk through problems, figure out different strategies for getting through certain things. So it's great for that. There's also we do that via Zoom. And then also there's a chat feature in there too. That's a lot like Facebook. You can get on and chat with people, ask questions. Our coaches and the owners, myself, are all in that chat as well. So it's a really great resource when it comes to wanting access to somebody who really knows what they're talking about when it comes to insulin resistance. And if you want even more help, they do offer one-on-one coaching, or if you really want a lot of help, you can sign up for a medical consult with me. So a few other tools to help. So here's one that I really like, and I have been incorporating a lot more lately, especially with this big GLP-1 surge, the GLP-1 medication surge. And so this is called the Feel Great system. For those of you who have never heard of it, it is a all-natural nutraceutical system that works to do exactly what we're trying to do. We're trying to lower insulin. And so this is a fasting tool. It's going to help you fast easier because the Unimate in it, and I have it listed here too, The Unimate, in the studies that Ben Bickman actually did on this exact product, do show a boost in GLP-1 by 60 to 70%. And that's no small amount. That's an actually very large amount. And so if you can boost your own natural GLP-1 just by sipping on a tea while you're fasting, why not try it? I think it's a great opportunity. It does help to quiet the food noise. It helps to suppress appetite. There's a little bit of caffeine in it as well that can help boost some mental clarity and energy and that kind of stuff. But it also has something called theobromine in it, which is very calming. And so if you're sensitive to caffeine, the theobromine kind of cancels out the buzz that you can get. And they do, if you're worried about the caffeine, they do have a caffeine-free option now available. The balance piece I really like as well. And so this is a fiber supplement that is unique because it is both soluble and insoluble fiber. Your fibers such as Metamucil or Benefiber are only insoluble fiber, and that only does us so much good. Sure, it might help you poop a little bit better, but it's not going to do the things that I want it to do. The insoluble fibers, so these are fibers that you don't digest very well. So seeds, the skins on certain things, the stalks, the celery, the strands in the celery, those are all insoluble fibers. And they form a matrix or a lattice work inside of your GI tract. And then the soluble fiber comes along and it actually kind of covers it up like a gel. And this will help to heal leaky gut. It helps to feed your microbiome, which is really important when it comes to all the things that we're discussing. It also stunts or blunts glucose response to food. And so if you're taking this, if you decide you want to have some carbohydrates, but you don't want to have all the negative side effects with it, having this fiber supplement prior to those carbohydrates, Dr. Bickman again has shown that there is a 40-point reduction in the glycemic response to foods by just incorporating the fiber first. That's unfortunately what we've done in America with all the processing. We've taken the fiber out. And so we have these rapid high spikes of blood sugar, followed by spikes of insulin, leading to all of this weight gain. And so it'll help with that. It also helps fill you up faster and it'll keep you full longer. So there's a lot of benefits to the balance. Really cool thing about the company, they do offer a 100% 90-day money back guarantee, which I absolutely love. It's easy for me to convince people to try it because if it doesn't work, no harm done. You get 100% of your money back. If it does work, yay, you got to stay off of those prescription medications and you found a natural way to improve your health and support your insulin smart lifestyle. So if you use this product, it also does come with a fasting app, which can help you with your fasting. And they do have a lot of other amazing supplements that I really like available if you want to look into them. And the link for that will be at the end as well. And if you want the link, you can certainly DM me and I'm more than happy to send it. So some other things that can help, just a couple more options. Allulose. Allulose is a very natural non-caloric sweetener that also works to help boost GLP-1. And so I like to add this or replace other sweeteners with this. So if you're already using monk fruit or erythritol or something like that, replace it with allulose because it will boost GLP-1 better. It helps lower blood sugar better. The only downside to the allulose is it's not very sweet. It's about 70% the sweetness of regular sugar. And so if you want something to taste sweet, I recommend to add a little monk fruit or stevia to it to get that sweetness boosted up. So this one we typically recommend about 30 grams a day in divided doses. Again, can be very helpful. If you couple this with the Feel Great system too, then you get probably even better than that 60 to 70% boost in GLP-1. So another tool that I'll use sometimes in people is MCT oil. This stands for medium chain triglyceride. When we have been a sugar burner is the words that we use. When you've been a sugar burner for a really long time and not a fat burner, it takes a little while for the body to figure out what to do. It doesn't understand. The mitochondria don't recognize what a ketone is anymore. And so if you even do create ketones, the mitochondria won't use them. And so we'll have those same symptoms of things like fatigue, weakness, brain fog, etc. And so if you start eating the way I've recommended that you start eating, if you have those symptoms still, MCT oil can be really helpful. And so again, particularly with fatigue, be careful with this because if you ramp up on the dose too fast, it'll cause some diarrhea. And so I recommend to start with a teaspoon 1 to 3 times a day and gradually work up to a tablespoon 3 times a day. This is definitely a training wheel. This is not something you would have to do long term, only in that transition period when you're going from sugar burning to fat burning. And then last, even a heavier hitter than the MCT oil is exogenous ketones. And exogenous ketones have become kind of a hot topic Ben just released, I don't think it's actually released yet, but he told us about a study he just completed and a different study that was actually published. That one was published. But the normal ketones that we have been recommending for people contain something called 1,3-butanediol. And he found with this specific kind of ketone that it actually made things worse. And so if you want to take a ketone, make sure it does not have 1,3-butanediol in it. You want to use one that is free of that. And the two recommended ones that we have, I've got the links for here. Again, message me if you can't grab them off of here, and I'll try to put them in the chat too before we're done. So yeah, so those are an option. Again, a training wheel, not something you would have to do long term, but would be really beneficial when it comes to that transition period from sugar burning to fat burning. So now what do? We're going to put it all together, and I call it the 4 A's. So number 1, accountability. Make sure you have some accountability pieces in place, whether it be a support system of family and friends, coaches, or even some of those devices I talked about, the CGM or the ketone monitor, etc. Make sure that you have really decided about the availability you have to things. Do you have the money to make some of these changes? Do you have the time? Do you have the access? Here in Belize, it's hard to get a lot of the things that I've mentioned. So is that a barrier to what you might be able to accomplish? Are you aware of things going on? Self-sabotage is a big one. People do this all the time. So be aware of that. Make sure that you know, like if you have a break room at work that is always full of sweet treats and things that are a problem, maybe you need to change and not go into the break room anymore or something like that. Improving your home environment is huge. I always tell people, you have 2 choices. You can waste it or you can waste it. And when I say that, I mean W-A-I-S-T, around your waist, or you can waste it, W-A-S-T-E, in the trash. In the long run, you're going to be a lot happier getting rid of it. If you feel guilty about doing that, give it to a neighbor, take it to a food bank. There's lots of different options on getting rid of those foods so you're not tempted. Make sure you have a plan. Make sure you know your lab values and how severe your illness is so you're fully aware of your situation. And then last, put it into action. Get organized and get started. There's no reason that we can't do this starting tomorrow. So make sure to involve those who you need to support you, whether it be your doctor, your family, or whoever. But make sure you have that support system in place and the people and the pieces of the puzzle that you need in place to get going. So again, here are these links. The Fullscripts link is here, the BioT, the coaching at Insulin IQ, which is just insuliniq.com, the Keto Mojo. For the lab ordering, I'm going to go over a lot of that detail tomorrow because we're going to deeper dive into the labs. And so if you want to order cash pay labs through myself or through Insulin IQ, I'm going to give you all those details tomorrow. If you can't watch tomorrow or can't get the recording, again, just DM me and I can give you different instructions. The CGMs are listed here. And again, the Feel Great system links are there. The exogenous ketones, and then the consult. If you wanted to work with me one-on-one at Ven Integrative, then there's that one. So now on to what's for tomorrow. So if you are doing everything right, and I had a gal reach out to me already earlier this week who was watching these, she says, I'm doing everything right and nothing's getting better. Well, tomorrow we're going to talk about this. So what specific lab testing do you maybe want to do? And we'll talk about different statuses or different scenarios where different labs would be important, but other labs may not be so much. We're going to do a full review and explanation of these. And just so you know, next week, actually, I'm going to do a full hour just on deep diving into lab interpretation. So that'll be a good one. And I will post here and on other socials as far as what day and time that will be. Options for optimizing other factors are going to be discussed. And then anyone that has more in the picture, you know, whether you have polypharmacy or something along those lines, we're going to dive into that tomorrow as well. And so I always say, I love that my last name is Venn because I get to utilize the Venn diagram and feel free about it. And so there is way more to it. We've talked a lot about metabolic health here in these last 3 days. We've talked a lot about insulin. We've talked a lot about fasting and food, but there's a lot more to it. And so we want to make sure that if we need to dive deeper into any of these other topics that we can do that. And I'm more than happy to help. So yeah, let me stop sharing my screen and put this away, and I'll get into the chat and see if there's any questions out there. Again, if you want to make sure I see it, go ahead and post it again. Sandra wanted to know if she could get these slides. The slides are a little bit harder to do, but if you go to YouTube at Ven Integrative Medicine, this recording will be there for sure. If you can't find it, just DM me here and I will get you the link to YouTube so you can see it. So thanks, Ro. You're so sweet. Let's see here if there's any other. Charlene says she loves Keto Mojo. So do I. They're a great product. So, and Carly put in there, livingthegoodlifenaturally.com has that magnesium soak. It's in the chat, and the code InsulinIQ for 10% off of that. So we love that soak. I have it. Carly uses it. It's a wonderful option. You actually get better absorption if doing magnesium in a soak. So if you're worried about low magnesium, a soak's a really good option. Let's see here. What else? How much magnesium daily? And so daily, I start with 400 milligrams. And again, just titrate based on your stools. Some people can only tolerate 200 milligrams. Some people need way more than that because they're constipated. So 400 is a really good dose for that. And again, the glycinate is the one I typically recommend. And again, if you're sensitive to magnesium, check out the soaks. So let's see here. It looks like all of it, unless I'm missing something. Carly, ping me in a text if I am. I don't see any others on here. Again, let's do this again tomorrow. Let's finish this up and get into the deep dive portion of it. Again, if you feel like you're doing all the right things and it's just not going in the right direction, then make sure that you join tomorrow because we're going to go into a lot of that. So perfect. And I will do my best to get on this specific recording once it posts and settles and get those links posted in there for everybody. So anyway, have a good night. Thanks again.